Dr. Jerry Williams with Urgent Care 24/7, here to talk to you today about sunburn. And if you've gone searching for this topic, maybe yourself or a loved one or a friend has gotten a little bit too much sun exposure. And let's hope it's a little bit, not a lot. So I'm here to talk to you today about what's the best thing to do with sunburn. And sunburn, as you know, is an overexposure of UV radiation from typically being out in the sun. And obviously more fair-skinned people are more susceptible to sunburn. The more melanin we have in our skin with darker complected people can have more sun tolerance. But anyone can get a sunburn, and if you end up with a sunburn, usually it can sneak up on you, and it can be extremely painful. And here in Savannah, Georgia, on the coast, not that the coast is unique for only where sunburns occur, but obviously here at the beach we see a lot of sunburn, and we see some extremely severe sunburns. I'd say the worst ones we see are when folks have actually fallen asleep relaxing out on the beach, and they fall asleep and they get very, very severely burned. We've had patients come in with severe second-degree burns and dehydration and very, very severe pain. And these are sunburns that are of the severest kind. You can actually also have third-degree burns, though that's incredibly uncommon. But we have severe burns occasionally, and again, these individuals are very, very uncomfortable. So what can you do if you've got a sunburn? Well, first thing I want to talk about is the best way to handle a sunburn is an ounce of prevention's worth 10 pounds of cure. So I encourage you to wear appropriate clothing that covers things, and if you're going to get some sun exposure, which we need for vitamin D, right? Be careful, all things in moderation. And if you're going to be out in the sun, apply an appropriate sunscreen with a appropriate amount of sun protection that will keep you from getting burned. But let's go to once you're burned, you got a sunburn, and what are you going to do about it? And the first thing I would encourage you to do is to use a soothing sunburn gel that will help with the pain and discomfort. Now, if it's a second-degree burn where there's actually blistering, we actually, in these cases, treat it like a burn, and we'll use sulfasilidine cream, which is used in burn patients, and that helps prevent infection. Is also can be very soothing. Sometimes we have to use non-steroidal anti-inflammatory drugs such as ibuprofen or naproxen sodium to help cut down on the inflammation and the pain. And also keep in mind these patients can be dehydrated not only from being out in the sun, but also if they have blistering and have a breakdown of the skin, there can be loss of fluids through the burned area of the skin, where the skin can quote unquote be weeping, and you can actually lose fluids through your skin. That's in the severe cases. So if you've got a sunburn, again, using an emollient type sunburn cream or gel can be very, very soothing if the skin's intact. If the skin is blistering and not intact, you're probably going to need a topical antibiotic and soothing ointment or cream, and you'll need to see your healthcare provider for that. And a lot of people say, well, it's just a sunburn, I'm not going to go to the doctor. Well, if it's a severe enough sunburn, I encourage you to go get seen, because by appropriate treatment of the burn, you can decrease the recovery time from the sunburn, and also decrease scarring if the burn is cared for appropriately. And you want to also prevent secondary infection. So that's some tips for sunburn. I hope you don't get one this summer, but they do happen, and I hope this has been helpful. Hey, Dr. Jerry Williams here from Urgent Care 24/7. Thanks for watching the video. I hope you found it to be useful. If you could do me a favor, if you like the video, be sure to click on the like button. Also hit subscribe, and when you hit subscribe, click on the notifications and click the bell there. That way you'll be sure to be notified every time Urgent Care 24/7 and Affiliates releases a new video. And remember, life is 24/7, and so are we.